Hi, I'm CJ Nance. Okay, this is the room we're using. That's my rubric all laid out. It'll be behind me the whole time. There is my blank sheet of paper with a Sharpie. We are in a peds treatment room, so there's some IV stuff, a lab paperwork, and information on IVs. There's computer. There's the hand sanitizer that I'll be using off screen. Gloves. There is a laundry basket and 2 chairs in the corner here. There is Miss Brittany, and there's a Dynamap in the corner, and then here's all the things that I am using. I'll use the otoscope on that back wall, and we will get started. Okay. So, hi, my name is Cedar Nance. I am a nurse practitioner student, and I will be doing a head-to-toe assessment on you today. You consent to that? Mm-hmm. Okay. I'll go ahead and get my hands washed, and we'll get started. All right. So on general appearance, you appear to be well-nourished, well-developed, you have good posture, you appear your state of age, and we will start with a little bit of a neuro assessment. So you can tell me your name and your date of birth, please.
It's Brittany, 10-9-91.
Okay. Do you know where you are?
The hospital.
And why?
I'm just getting an assessment done.
Okay. And the month and the day, or month and the year.
November 20th.
Very good. And I'm going to tell you 3 words. I'm going to have you repeat them back to me immediately, and then I'll ask for them again here in a little bit. So we'll do dog, phone, coffee.
Okay, dog, phone, coffee.
Very good. And what's your telephone number?
812-431-3675.
And your age?
29.
And your year of birth?
91.
And the President of the United States?
Trump.
And could you count backwards from 100 by sevens?
193, 86.
Very good. I will have you draw a clock on my sheet of paper here. And I will have you draw 2 o'clock. Very good. And we'll do 2 o'clock. Let's see. And what are those 3 words again?
Dog, phone, coffee.
Very good. Throw some gloves on and get a set of vitals on you. Okay, I'll go ahead and have you put that in your mouth. And this on your forefinger. And count your pulse and respirations. So your pulse ox is 98%, your pulse is 64, and your respirations were 16 times a minute. Take your blood pressure. Blood pressure is 112/76. Just wait on that. There you go.
98.2.
Alright, and your temperature is 98.2. Okay. So we'll start just kind of going from head to toe. Actually, I lied. I'm going to feel your skin for temperature. So your skin is warm and dry. On inspection, from what I can see, there's no masses, lesions, rashes, anything to be concerned about. Appears all normal. And I'll assess your skin trigger. Your skin trigger is appropriate for age. So now looking at your head, it appears symmetrical. I don't see any obvious masses or lesions. You've got blonde hair. It's dispersed appropriately. There's no signs of alopecia. And then I'm going to go ahead and palpate. You tell me if you have any pain with this. Any pain? All right, so no tenderness on palpation. You're normal cephalic and atraumatic. I'll go ahead and have you take your mask off. And it's fine. Your eyes are symmetrical. There's no discharge, masses, no lesions noted. Your sclera is white. I'm going to check your conjunctiva. It's pink. Your ears, no drainage noted, no masses, no lesions. I'm going to go ahead and palpate. Tell me if there's any pain. Very good. Your nose appears symmetrical as well. No drainage, masses, or lesions. Again, with your mouth, no masses or lesions noted. Your lips are pink and moist. And again, all four of those aspects of your face are symmetrical. So we will go ahead and do an eye exam. Do you wear any corrective lenses? Okay. So we'll measure this out. And cover your left eye. Read that bottom line there.
LTNPH.
Very good. Cover your other eye. Read the same line backwards.
HPFTL.
Very good. And read it with both eyes together, the last line.
LTNPH.
Very good. So this tells me that your visual acuity is 20 out of 20. And it tells me that your cranial nerve number 2 is intact. So I will now assess your cranial nerves 3, 4, and 6. So the first assessment I will do is checking your pupils for contractility. So I'll have you stare at that back wall, and then I'll shine a light in your eye. And the first time I shine it, I'm looking at the pupil with the light, and the second time, looking at the pupil not in direct light. Very good. And they contract appropriately, bilaterally, and equally. Okay? And now, well, I'll finish this. So, you take the pen light, you keep your head still and just follow it in the directions that I move it. Very good. I'm going to move it close to your face. Keep your eyes on it. Very good. And now I will have you focus on the pen light and on the back wall. Pen light, back wall, pen light, the back wall. Very good. So, Perla and your eyes move in coordination with each other. There's no nystagmus present. And now I will examine your eyes with ophthalmoscope. So, if you just want to focus on the back wall, I'll shine this light in your eye. My face is probably going to get pretty close to yours, but I will be quick. Take a look inside your eyes. This machine allows me to do that. So, your red reflex was noted bilaterally. I can see your optic disc and optic cup. In both eyes, they had clear borders. They were pearly white in appearance. There was no AV nicking or papilledema present either. So now we will assess your hearing. We'll do a couple different hearing tests. I'm going to stand behind you and say 3 words. It's called a whispered hearing test. So while I'm back here, I'll have you plug your left ear and repeat the words that I say. Fish, dog, cat.
Fish, dog, cat.
Very good. And now plug your other ear. 1, 2, 6.
1, 2, 6.
Very good. And now we will do the Weber and Rennie tests. So this is a tuning fork. I'm going to make it vibrate. Put it behind your ear. You tell me that when you can, or if you can hear it when it stops, and then I'll do it on the other side. Okay? You hear it? Okay. Tell me when it stops. You hear it now? Okay. And then on this side. Can you hear it? Yep. Tell me when it stops. You hear it now? Okay. And I'll do it one more time, and I'm going to put it in the middle of your forehead, and you tell me if you can hear it in your ears equally. Very good. That tells me that cranial nerve number 8 is intact bilaterally. And I'm going to take a look in your ears. So I'm going to pull it up and back to visualize this tympanic membrane, which is pearly gray in color. And again, I'll side, pulling up and back, visualizing the tympanic membrane that is pearly gray in color. It is also not bulging, your ear canals are patent. There's some yellow cerumen noted, but nothing out of the ordinary. And now we will assess your cranial nerve number 1. So I'll have you pull your mask down a little bit. And cranial nerve 1 is olfactory nerve, so I will have you close your eyes and plug one nostril and ask you to identify the smell. What's that?
Coffee.
Very good. And do the other side. Plug the other nostril. I'm going to smell this is.
Lemon.
Very good. I will take a look in your nostrils as well. Stick your head back a little bit. Alright, so both nostrils are patent. No erythema or swelling noted. And no septal deviation noted either. So I'm now going to test for TMJ. So put my hands on either side. Just open your mouth real big. Close it. Okay, any pain with that? Okay, there was no coughing or crepitus either. You don't have TMJ. And I will also, we'll go ahead, I will have you make a couple funny faces. So I will have you smile real big and frown and raise your eyebrows and puff up your cheeks and stick out your tongue, wiggle it back and forth, and raise your shoulders up, put them down, and turn your face that way, and resist me coming back. Very good. And the other way, resist coming back. Alright, so that tells me that cranial nerve 7, 12, and 11 are all intact. Now I'll assess cranial nerve 5. So I've got 2 objects here. I've got a sharp and a dull. So here's dull, and here's sharp. Okay, so I'll have you close your eyes. I'm going to test these over different areas of your face.
Sharp. Sharp. Dull. Sharp. Dull. Dull.
Very good. We'll do the same thing on the top swab. You don't have to say sharp or dull. Just say yes if you feel it.
Yes. 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 Yes.
Wonderful. Cranial nerve 5 is intact. And now I will assess your mouth. So I will have you open and stick out your tongue and say ah, okay, and cough. Thank you. So your uvula moved midline when you said ah, which is an appropriate finding. Your dentition appeared normal. There were no missing teeth or obvious cavities. Your buccal mucosa and the rest of your mouth mucosa was pink and moist. Your pharynx was visualized. There was no erythema or swelling. And your bilateral tonsils were also visualized with no erythema or swelling. And now I will palpate your maxillary and frontal sinuses. So I'll palpate frontal first. Tell me if you have any tenderness. Okay, maxillary. Very good. Also, when I'm palpating, I will palpate your lymph nodes. So that's fine. So your preauricular lymph nodes, non-palpable. Post-auricular, non-palpable. Occipital, non-palpable. Carotid, non-palpable. Tonsillar, non-palpable. Submandibular, non-palpable. Submental, non-palpable. Superficial cervical, non-palpable. Posterior cervical, non-palpable. I'll have you lean your head this way. Deep cervical, non-palpable. Raise your shoulders up for me. Supraclavicular, non-palpable. So all the lymph nodes that I listed, they are all non-palpable bilaterally. Okay, I'll also have you swallow. So I'm going to palpate. Okay. So cranial nerve 9 is intact. And your thyroid, when I palpated it, was soft. There were no nodules. It rose midline. When you swallowed, was there any tenderness when I palpated? Okay, so it was not tender. And see, now I will assess you for JDD. I'll raise the bed up to 45 degrees and have you lay back. first our Snelling chart has a ruler on the back of it. So first I'm going to visualize the JV pulse and place my ruler in the sternal notch and use this time depressor to measure. It's 1 centimeter, which is a normal finding. Anything over 3 centimeters is considered abnormal, would indicate JVP. So again, locate the pulse, and place that in the sternal notch, and measure again, 1 centimeter, which is a normal finding. So now I'm going to palpate your carotid arteries. So they're brisk but not bounding. No thrill is palpated. I'm going to assess for a bruit. So when I'm listening over your carotid, just hold your breath for a second. I'll be quick. All right. No bruits noted. I will lie you flat. And I'll have you take off the top half of your gown. Very good. Okay. So I'll do your cardiac inspection and assessment. So I'm going to identify the angle of Louis. And then I'm looking for any thrills, heaves, or lifts. There are none present. I'm looking for the P and I. Okay, and it's palpated on the 5th intercostal space, mid-clavicular line. It's about the size of a nickel. I'll go ahead and listen in all 4 quadrants. I'll listen over the aortic valve, pulmonary, tricuspid, mitral. Now I'll listen with the bell of my stethoscope. I'll have you turn on your left side. When I listened, S1 and S2 were heard. No extra sounds, no S3, S4, gallops, rubs, or murmurs, but having you lay on your left side could sometimes draw out some murmurs, so we'll listen again, just laying on the left side. Again, over all 4 of the same regions. And again with the bell. Alright, and again, no extra sounds were heard, just S1 and S2, which is a normal assessment finding. Now, inspection for your respiratory assessment. Just on general inspection, you don't appear to be using any accessory muscles or have any respiratory distress. So I will go ahead and palpate. So do you have any pain in your chest? No? Okay. Now I will assess for tactile phrenitis. So every time I put my hands on your chest, go ahead and say 99. 99, 99, 99, 99. Tactile phrenitis is present and equal bilaterally. Now I'll percuss. Alright, resonant percussion tones were heard in all long sounds bilaterally. I'll go ahead and listen. I'll listen twice. The first time, just breathe with an open mouth. And now this time say E every time I move my stethoscope. E, 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 E. Alright, I'll go ahead and have you sit up and face this back wall. Lung sounds were clear bilaterally, and no consolidation was noted due to the fact that when she said E, I also heard E in the stethoscope, so when we were listening for E with me. So again, we will do the same thing. I'll have you say 99 every time I touch your back. 99, 99, 99, 99, Good. Tactile firmness is present and equal bilaterally. I will percuss again. Okay. Resonant percussive tones were heard again in all lung fields. I will also listen again. The first time, just take deep breaths. Also listen laterally. Side as well. Okay. And now say E. Alright. Breath sounds were cleared bilaterally. And again, no consolidation was noted when we were testing euphony. Have you lay back again? And we'll do your abdominal assessment. And let's see, on general inspection, there's no masses, lesions, rashes, striae, anything that would cause any alarm. I will go ahead and auscultate. I'll auscultate twice in all 4 quadrants, once with the diaphragm, once with the bell. Now with the bell. Active vowel sounds in all 4 quadrants. I will now percuss. Okay. Tympanic percussion sounds were heard in all 4 vowel quadrants, which is an appropriate finding. I will now do light and deep palpation. So tell me if you have any tenderness with this. If you want, you can raise your knees up. There you go. So light palpation in the right upper quadrant, left upper quadrant, and we do light palpation to assess for any tenderness that you may feel. And now we're going to do deep palpation in all 4 quadrants. So this is to assess for masses. So in the right upper quadrant, you've got your liver, your gallbladder, and the tip of your right kidney. The left upper quadrant, you've got your spleen, pancreas, your stomach, and the tip of your left kidney. The left lower quadrant, you've got your ovary and your bowel. And right lower quadrant, you've got your appendix, your right ovary, and bowel as well. You have any pain with that? All right, very good. I will now percuss your liver for edge and span. Now I'll go ahead and percuss. Okay, I'm going to borrow your finger. I'm percussing to listen for the different sounds as we go over the liver, and it becomes dull, and when we get off of it, it becomes, put your finger here, tympanic again, or resonant as in the lungs. I forgot my ruler. Our measure, it's about 7 centimeters. You can go ahead and relax your arms. And now I will assess your kidneys, so this might be a little uncomfortable. I'm going to put a hand below you and above you. I'll have you take a deep breath in and blow it out. Okay, just attempting to feel your kidney. It's called allotment is the technique. So hand below, hand above, breathe out. Alright, and I couldn't palpate either one of your kidneys, which is a normal assessment finding. That's just fine. And I will now have you sit up and face that back wall. I'm going to percuss your costovertebral angle. Tell me if you have any pain. Any pain with that? No. Right, good. Any pain with that could indicate some inflammation of your kidneys. So now I will start your spinal assessment. So I'll start by palpating your cervical paraspinals and your thoracic paraspinal muscles and your lumbar paraspinal muscles. And there's no spasms noted. Do you have any pain with that? No pain or tenderness, and appropriate muscle tone. So I'm also going to have you bend your head forward a little bit, and I'm going to feel your spinous processes going down your back. Right here is C7 and T1. And keep going down. Feel all the spinous processes, and they are all in alignment. Was there any pain with that assessment? All right, very good. I will now have you do some range of motion with your neck. So I'll have you look all the way down the floor, and up to the ceiling, and back to center, and then look left to right, and then bring each ear down to each shoulder. Very good. And we'll do the same thing with your lumbar spine. So if you could bend forward and bend backwards, arch your back. Very good. Back to center. If you could do like a lateral side bend. Very good. And if you could twist for me. All right. So there's active range of motion. The cervical and lumbar spines is appropriate with flexion, extension, and lateral bend. So I will have you, I'll have you lay down for this next part. And you can put your gun back on your shoulders if you'd like. So I'll start with an assessment, just looking at your extremities. Again, I'll assess for temperature. They are warm and dry. No cyanosis or pallor noted in bilateral upper extremities. Cap refill is 2 seconds. If any pain in any of your joints. Okay, I'm going to palpate your radial pulse. Equal in rate and rhythm, and it's 2+ bilaterally. It's your brachial pulse. Again, equal in rate and rhythm. It's 2+, equal bilaterally. And now I'm going to assess your legs for temperature. And you're dry and warm. No pallor. Cap refill is 2 seconds. No clubbing or cyanosis or edema or varicosities visualized in the lower extremities bilaterally. I'm going to palpate the DP pulses. They're equal in rate and rhythm, 2+ bilaterally. And your PT pulses are equal in rate and rhythm, and 2+ bilaterally. Okay, so now I will have you do some passive range of motion. Or also, do you have any pain in any of your joints?
No.
Okay. So I will, again, have you do some passive range of motion. I will have you make a fist, and I will bend it back and forth. Tell me if you have any pain with any of this, okay? Now bend your arm like a curl, and then I'll go out to assess your shoulder. Okay. And again, make a fist, and I will bend your wrist, your elbow, and your shoulder. Okay, and then I'll have you do those same motions, active range of motion, so you do it yourself. Very good.
That's what I remember.
Good, and then up. Wonderful. Any pain with that? Okay. Now I'm going to assess your muscle strength, so go ahead and make your fist again. Okay, and then resist against me when I push. And pull back. Very good. And then pull. And push. Okay. And go ahead and try to push your arms out. And in. Very good. Okay, so with active, passive, and range of motion, any pain with any of that. No pain, crepitus, popping, or stiffness. Muscle strength is 5 out of 5 on bilateral upper extremities. So we will do, again, passive range of motion with your hips, knees, ankles, feet, and toes. Okay, and then, again, passive range of motion with all of those same joints. Any pain with that? Okay, go ahead and do that active range of motion, so on your own. Very good. Any pain? Very good. Okay, I'll have you pull this leg up to your chest again. I will test your muscle strength, so push against me. Good. Push against me. Very good. And then I'll have you straighten that leg. We'll do this one. So push against me. And against me. Very good. You can straighten that leg out. And I will have you press against me like gas pedal. Put your nose to your toes, or toes to your nose. And wiggle your toes again. Very good. I'm going to test the proprioception. So active, passive, range of motion in bilateral lower extremities as appropriate in knees, hips, ankles, feet, and toes. Muscle strength was 5 out of 5 with no pain. No pain in that assessment, no popping, no crepitus. So now I'm going to set the proprioception of your big toe. So you just tell me if it's down, up, or in the center. Close your eyes for me. Down, up, down, up. Very good. So bilaterally, the proprioception of the big toe is appropriate. I will also have you take this heel and put it to this shin and drag it down. Very good. That's testing your coordination, so go ahead and do it on the other side. Very good. And assess the vibratory sense in your bilateral lower extremities. So I'll have you close your eyes, and then I'll put this on your toe. If you can feel it, tell me. When it stops, tell me as well. Feel it? Yep. Stop? Okay. Can you feel it? Yep. Yep. Stop? Stop. Okay. And then I will have you, sit up on the edge of the bed. We'll face that way. And just try to stay scooted up real high here so we can see. Very good. So I'm going to assess your deep tendon reflexes. So I'll see your wrist, so your brachioradial, okay, +1, and then your bicep, +1, tricep, +1, on the other side. Again, brachioradial, +1, bicep, +1, tricep, +1. So those are all appropriate findings in bilateral upper extremities. We'll do your patellar and your Achilles. +1, +1, +1, +1. So +1 bilaterally, all appropriate findings. I will now have you, we will do some rapid alternating movements with your hands. So put your hands on your lap and then flip them back and forth as fast as you can. Very good. And we'll do the same thing with your feet, but I'll help you. So I'll put my hand down here and you just have your foot as fast as you can. Very good. Very good. Okay, and one last coordination, or one of the last coordination tests. I'll have you touch your finger to your nose, and then touch my finger. Nose, my finger. Nose, my finger. Very good. Let's see. I will also assess, so go ahead and close your eyes. I'm going to put a familiar object in your hand. You tell me what it is. Key. Very good. Pin. Okay, so stereognosis is intact. And I'll have you close your eyes. I'm going to draw a number in each of your hands. You tell me what it is. 1, 8. Very good. So graphesthesia is also intact. Just for health maintenance, I'll ask you, have you had a caption in the past 3 years? No. Okay. So that would be something to talk to your PCP or your gynecologist about getting. At age 29, you do want to be getting a caption every 3 years to screen for cervical cancer. That starts at age 21. And thank you for letting me assess you today. I'm going to take my gloves off and go wash my hands. And I'm going to check my rubric to assess if I've missed anything. Oh, I forget a few things. I'm going to assess your plantar reflex. So, okay. That's appropriate findings bilaterally. Her toes curled down. And I will also have you close your eyes and hold your arms out in front of you. This is assessing for pronator drift. Right, and no drift is noted. So you can go ahead and open your eyes and put your arms down. And I'll have you stand up and put your feet together. And close your eyes. This is Romberg's test. It's a testing coordination and balance. Right here in case you feel wobbly. I am going to press on you a little bit. Test your balance. Very good. That all seems intact. Okay. Again, thank you for letting me assess you, and I'm going to go wash my hands again. I don't know how to log into your computer.
Should have wrote down the password.